say goodbye to my family before I came.
Oh. That felt good.
Like this.
Whoa. I feel like I'm at the dentist's office, but I feel way more nervous.
Okay, so this is how we figure out where to adjust in the spine. Did you tense up on that one? Or was
A little bit. It went all the way down to that spot.
Okay. Breathing, sinking, let that go. Painful?
A little bit.
Down. What's this scar from? There we go. Now it's a little softer on the inside. Put your elbow back against my hand right there. Push, push.
Ooh, that was fun. I have like the shivers, like you know when you get cold?
You're not cold though, right?
No.
It's 77 degrees in here.
Nope, I'm not cold. I think whatever you just did is like, it's like electricity.
It's that time of year again. The FlexiSpot anniversary sale is here. You guys already know I love this company. I've been using their products since 2019. I've never had one problem with any of their products. Everything they've sent me has been shipped safely and secured. They're easy to put together, and when you get your hands on a FlexiSpot chair, desk, or bed, you'll know it was built with quality craftsmanship. They cut their steel with lasers. Come on. All their products come with 30-day guarantees, and there are warranties on everything. But as soon as you put your desk or chair together, you'll know why this is one of the best business furniture manufacturers on the market. They're BIFMA certified, and that's why it's easy to recommend FlexiSpot. FlexiSpot is here to bring you high-quality, ergonomic, healthy office furniture. If you sit at a desk for your job, I highly recommend you get an adjustable height desk. Adjustable height desks will save your life. They're not only good for your back, they're good for your organs too. There's like an hour of me on the internet scattered throughout random FlexiSpot commercials explaining the benefits of standing at your workstation. And when you're not standing at your workstation, FlexiSpot has amazing office chairs for you. There's a great sale on the C7 ergonomic office chair. This chair has a dynamic lumbar support system, which basically means anytime you move, it adjusts to your every movement. It can accommodate multiple sitting positions. The 20-inch cushion can accommodate both legs for a cross-legged style. The cushion tilt can support you when you're leaning forward. From upright sitting all the way to the lounge position and a footrest, FlexiSpot gives you the kind of ergonomic support you need and deserve. The handrest positions are virtually unlimited and can go anywhere. Adjustable height, a lock-in lounge. It supports up to 300 pounds, and the mesh design allows for a breathable and comfortable support for long periods of sitting. The C7 office chair is boss. Use my link in the description and in the pinned comment. Get a discount when you use my code at the FlexiSpot anniversary sale. Go to flexispot.com. All right, so I know we're here for neck pain primarily, correct?
Yes.
All right, let's talk about it. How far back have you had it?
This went back to an accident that I had in 2008, I want to say, when I was in college.
You got into a car accident. Tell me about it. Was it bad?
I mean, for my car it was. I thought I was fine, besides like the whiplash part. Mm-hmm. But I was so scared that it happened that I didn't go to the doctors and get examined afterwards or anything. I just wanted to go home. So it wasn't until months later that I actually started like really feeling that it wasn't going away, and it was like going further down my back from just my neck. And then that's when my migraine started too. Okay. So.
All right, so that's 17 years ago.
Yeah.
Take me through the progression. How bad did it get, or has it gotten? Have you seen anyone for it?
I did go see the doctor, and they recommended chiropractic work, but where they sent me was like kind of like a all-in-one thing. Like it was like therapy, chiropractor, massage, the whole thing. So it was just very like a blanket, generic. No one really ever figured out like what was wrong. It was just kind of like, I felt like a Band-Aid more than anything. Mm-hmm. And then I had my girls, and during the pregnancy it actually got really bad to the point where I was like having muscle spasms that I couldn't like move or get out of bed. And so on and off from there, it's just kind of come and gone, but it just seems like it comes in waves. And I'll notice it's coming because I won't be able to find a position to sleep at night. Mm-hmm. So I don't sleep all night long, and then I end up getting a migraine like during that cycle of not being able to sleep.
Sounds terrible.
Yeah, it's fun.
All right, how often does that happen?
For a while there, I think I told you I kind of felt like I was like in remission, like it wasn't bothering me, because I really started like focusing on my workout routine and kind of basing it around that. But it just slips in there, and I can't figure out what the cause is. But once I can't find a position to lay in at night, then it just kind of all spirals out of control from there. So maybe every couple of months.
Once every couple of months?
And then it lasts for like 2, 3, 4 weeks at a time.
Okay.
Until I come out of it.
So you felt better, and you're somewhat better, still improved since working out? Like that has helped manage it, or did it go back to what it was before?
I think it helped manage it, but I noticed now the more weight that I'm lifting, I think that it's starting to catch up to me. But I definitely have muscle imbalances from one side to the other. I feel like throughout my body in general. So I'll be interested to see what you have to say about it.
Which ones do you think are imbalanced now?
The shoulder, depression, one side is definitely raised and lower on one side.
Okay.
But then I also know, I think from past history, that one of my hips is higher than the other two. Mm-hmm. And I'm not exactly sure where it all stems from, but there's definitely from one side to the other. I feel like I can see a difference in my body pretty much everywhere.
Do you have anything with your jaw?
Yes.
I could see it from here.
Yeah.
What is it? Tell me.
I actually don't know what it was. I thought it was TMJ for a while. I would have a lot of clicking in there, and I would wake up I would get migraines from that too. But I could tell it was from my jaw because it would be so painful. And the dentist, all they really recommended was the little thing that you sleep with so you don't grind.
Ankles, knees, hips?
So I like to run. I'm not a runner by any means, but I do enjoy running. And I think because of the leg length discrepancy or whatever that is, I think the right side is lower. So it takes more impact than the left. So every once in a while I'll get hip pain from running and ankle pain on that side too.
All right, do you have any questions or anything before I start?
No.
All right, I'm going to do
I said goodbye to my family before I came.
Okay, looking at the feet first.
Mm-hmm.
Heel strike, mid stance, toe off, straight away. Absolutely perfect. No pronation, supination. I don't see any eversion, inversion. Keep going.
Okay.
Yeah, looking at the back of the heels. There is just a slightly more of a bow on the right than on the left. Mm-hmm. And then I could see just a little bit more from the posterior. That right foot wants to squeak out a little bit. It looks like a foot issue, not a hip issue. Looking up from the knees, they look symmetrical and even. That's good. No genuvarum, no genuvalgum. Hip swing looks symmetrical left and right. We do have it looks like a high left hip from here. It might be the shorts. I can't tell. And then, what's that?
The pleats in the pants.
All right, I'm going to touch the bottom of your feet, okay?
Okay.
All right, arches are intact, both sides equal. Turn around and face the other way. I'm going to place my fingers on top of your hips, okay? Okay, let your arms relax. Good, indeed, a high left hip, significantly. Shoulders, high left shoulder, significantly. Okay, you're going to feel my fingers on your hamstrings, okay?
Okay.
Looking at the glute folds here, it's lower on the right. So high left hip here, and then this one's, so this is forward like this, and this is backward. So this is pelvic torsion here. And then with the ribs as well, the right ribs are back, or the posterior in this direction, and with a high left, so you're like this. You're like that, and like this. Yeah, the whole thing's trying to go that way. Down your right, so the front line on the right is going to be dominant, and then the posterior back line, the posterior line on the back on the left is going to be weak. All right, I'm going to touch your back now, okay?
Okay.
Okay, so I can see the postural changes happening here at the thoracic lumbar or cervical thoracic transition. This is minimal, but we need to work on this. We're going to dig into this. This is probably part of the long-term compensation. Yeah, we have differences in your trapezius muscle here too. Yeah, you can feel that when you're working out, huh?
Yep.
Have you ever had pain that goes down your arms, numbness and tingling in your hands?
No.
Tender?
No.
How about this side? Is this tender?
Mm-mm.
Good. Okay, rhomboid muscles. This rhomboid up here is working hard. It's taking over for what's not happening over here.
Yep.
Okay, right or left? Or
Go
same?
left. What's that?
Or same?
Same.
It's a little squishy in there though, huh? Feel that edema?
Yeah.
Okay, let's bring your chin down to your chest. Any pain, discomfort there?
Mm-hmm.
Where?
Like, it goes the whole way.
Tell me where it stops.
Like, mid-scapula.
It's crunchy in there.
Yeah.
Do it again. Okay, stop. Yeah, there's multiple segments here that need attention, so let's do this. Bring your ear to your shoulder. Your neck cracks by itself.
Mm-hmm.
A little stiffer going to the right side here. Or this side.
This way.
Yeah, you feel it. You can't go. This is restricted here, right lateral flexion. When we go like this, where do you feel it at? Okay. If we go like this, do you feel it over there too, or do you feel it over here?
We're in the front, almost.
In the front. Okay, some scalene work then. Bend forward and touch your toes. Keep your head down too. Okay, you can sit back up. Okay, we need to do some soft tissue work here. Open up some of this tightness in the trap from its being overcompensated. But this is going to be very important to activate these muscles and activate this shoulder, activate the neck muscles here. They feel weak compared to the left side.
Yeah.
And it's significant enough to notice. When you're lifting and you're pushing bars around, you feel that.
Yeah.
Okay, this is long-term adaptation stuff here, okay?
Mm-hmm.
I can't fix that in one visit.
Yeah.
But this will help it move in that direction.
Okay.
And it'll also give you the potential and the space to fix it yourself with what you already know.
Yeah.
With, I'm sure, your daunting knowledge of anatomy and physiology.
Live in the best.
Okay, I'm going to lower that headpiece down just a little bit right there. Good, let that relax. Tender?
Yeah.
This side?
Yeah, but not as much.
That thing right there. Which one's worse, this one or this one?
That one. This is so tender.
Okay, so let's work on this a little bit. We're just going to open this up very gently.
My back should be super smooth now. I just got sanded.
Okay, so this is how we figure out where to adjust in the spine. This is called the trap fiber analysis from SOT technique. Which fiber is the most tender? It's going to be 1 through 7. Ready? 1, 2, 3, 4, 5, 6, 7.
5.
All right, so 5 tells us that we need to adjust T6 and L3. 95, 84, 70. No, that's wrong. T7 and L3. Okay, so T7 was this one up here that you said was tender.
Yeah.
And then L3 is down here. I'm going to touch the top of your hips here. Here's 3. We didn't really palpate down here. Ready? Left or right?
Left.
That thing right there?
Yeah. That thing right there.
Okay. Let's practice an adjustment first. Okay, so you get cracked. Brandon cracks you, so it's not that much different. You're going to breathe in. Let's practice it, okay?
Okay.
How you doing right now? You okay?
Okay, yeah.
Okay, take a deep breath in. I'm not cracking it yet. And out. I'm going to follow your breath down like this. At the end of your breath, I'm just going to push very quickly into that direction. There should be no pain with this whatsoever, okay?
I think it's just the neck stuff that scares me.
All right, that's fine. That's good. Here, I'm going to test this segment first. So ready? 1, 2, 3, 4, 5. It's still tender, right?
Yeah.
So now I'm going to come to T7 and push on it here. Does that feel better or same or worse?
Feels a little better, actually.
Feels a little better,
Yeah.
but not quite really the release that we're looking for. If I touch here and push on this segment, L3, better, same?
Nope, that's pretty bad.
That's painful
Yeah.
again? Okay. All right, so let's start at T7. Nice. Yeah, Okay, gentle breathing. As you breathe out, I want you to feel what it's like, okay? You're going to breathe out just like this. Then right from here is when I'm going to push, okay?
Okay.
All right, deep breath in. Nice, gentle breathing, sinking. Let that go. How's that, painful?
Felt kind of good, actually.
All right, so let's clear up this up here, T1, T2.
Okay.
This is just mechanical stuff. This is fine. We'll get this cleared up. There's more. Hold on. Take a deep breath in and out. Good. Tenderness right or left here, one more than the other, right?
Oof, they're both bad, if I'm honest.
Right here, right, left, right.
Left.
Okay, I'm gonna come back to that.
Okay.
All right, so this one's a little bit different. This time you're gonna take a deep breath in, and then as you breathe out at the top of the breath, that's when I push, okay?
Okay.
All right, let's give that a try. Deep breath in and out. Let your shoulders relax.
I didn't realize there were so many places you could crack.
Okay, so right here, right, left. It's left, right? I mean, correct? Left?
Yes,
Left is
left.
more trend? Okay. Okay, we're gonna adjust T2. Good. Let the shoulders sink in here and then very gentle push like this.
Whoa. It's like the left side already feels different.
Okay, let's look at your hips and see how these are aligned. Right short, that matches the high glute fold. I'm going to bend your knees here. Don't help me. Let me do
Okay.
the work. Good. And it crosses over. Right, PI. Do you have any stiffness in your back, tenderness when I do this?
No.
Still good?
Yep.
Go ahead and lift your right leg up in the air. Good, put that down. Whole leg, lift the whole thing up.
Oh.
Good. Down, good, good extension. Okay, left. Down. One side more difficult than the other, or is it even?
Even.
Okay, let's do it again. Right. Down. Left. Down. What's this scar from?
It was actually like a birthmark or mole, I'm not sure. But had it removed and now it's like scar tissue because they did a terrible job.
There's some scar tissue on the inside too.
Yeah.
I'm gonna work on that right now before I do anything else. There we go. Now it's a little softer on the inside. All right, we're adjusting the SI joint left here. 2 inches lateral, 3 inches inferior here. Okay, go ahead and take a deep breath in. Yeah. Good, shoulders relaxing. Good. A little push. Good. Line your back.
I feel like everyone is just like a little bit better, a little bit better. Still nervous about the neck though. Well, I will say whenever I got adjusted that one time by the other person, it actually hurt. And I think that's what scares me now too.
All right, so this is how we tell where to adjust the neck. Turn your head to the right, back to center. Now turn your head to the left, back to center. Bring your right ear down to your shoulder. Yeah, just like that. Back to center. Left ear. Back to center.
I feel like I'm at the dentist's office, but I feel way more nervous.
You're more nervous than the dentist?
Trying to be brave.
You're doing great. You know, it's just like the other cracks. All the things I already cracked.
I think it's because of the bad experience. Now I'm like terrified because my neck's already sore.
It's sore right now, right?
Yeah.
It's tense. It sucks right there, right?
Mm-hmm.
We should work on this first.
Okay.
Mm-hmm. Nice gentle breathing. Breathe through your nose.
It's so tender.
Okay, so for this one, I'm gonna bring your head to right here, okay?
Okay.
Then I'm gonna use my hand. I'm gonna contact your mastoid right here. I'm gonna use my hand and push it in that direction like that.
Okay.
Sound pretty simple?
Mm-hmm.
Okay, you're doing fantastic right now. You're nice and relaxed. I could do it just from this position, just like this.
Yeah.
All you have to do is breathe.
Okay.
As you breathe out, we'll follow the breath like this, and then just a gentle, gentle. And if you're not ready and relaxed, then I won't do it.
Okay.
All right, let's give it a try. Very nice. Good breathing right there. That was gentle.
Ooh. That felt good.
Deep.
You're telling me.
Yeah.
I don't really know what it's supposed to sound like.
That.
Felt right.
Mm-hmm. Well, was it scary or what?
No, I loved it actually. It didn't hurt.
Let me test and see which one. 7, 6, 5, 4, 3, 2,
Ooh.
1. We're gonna do it just 2,
Mm-hmm.
3. Okay, you're doing good. Gentle, gentle. Same as last time. We're just gonna lift the vertebra and push right like there, okay?
Yep.
Good breathing. And out. Good shoulders.
Ooh.
Oh my god. Nope. Did you tense up on that one, or
A
was
little
it me?
bit. It went all the way down to that spot, like
Yeah, it
in my
did.
scapula.
On the right?
Mm-hmm.
Painful?
A little bit, but not like I thought it was gonna be.
See? We're good. Good. Okay, just relax. Good.
Oh. Oh my god. Alright.
Alright, how's your digestion? Put your legs down.
I feel like better since I actually started that rise mushroom coffee. My digestion is not usually bad though.
Does it suck in here?
Yep.
You have to eat good to have good digestion though, don't you?
Yeah.
It sucks when you don't eat good, doesn't it?
Yeah. I don't like, yeah. I try not to stray too far from it.
Okay. Alright, I'm going to palpate your abdomen, okay?
Okay. Oh my god, that hurts so bad.
Yeah, this is a reflex for liver gallbladder here.
Okay.
Okay, so we're going to find the ampulla evaders where the gallbladder duct drains into the small intestine. We find it by going to the belly button, 2 inches lateral, 2 inches superior from there. Good, then we start at the costal arch.
See, whenever I had migraines, they made this little like plastic thing that you pinched in it, and it was supposed to, sorry, and it was supposed to help with migraines. It didn't help, but it's interesting that that's for something else, a different pressure point. I didn't realize that.
It could help with migraines though. Some migraines originate from the gut.
Okay. That spot's supposed to be tender.
I mean, no, but I can see it being tender by what it feels like to me.
Okay, because you keep finding it, and I'm like, ooh. I didn't even know that was a thing. What is the thing? Oh my god.
Oh, sorry.
Oh my gosh, that used to be the worst, like tickle torture. My brothers would, oh my gosh, that's what just reminded me of.
Is this side tender too?
Mm-hmm.
Okay, this one's for the stomach, the entry of the stomach into the small intestine of the pyloric sphincter. We find it by finding the belly button, the xiphoid process. Split that space in half. Put that away. Okay, gentle belly breathing. Can you breathe into your belly?
How do you keep finding that stuff?
This is the
Oh my gosh.
diaphragm, ligament attachments from the body cavities to the body wall. It's that rib torque that we talked about.
Yeah.
long term. Okay, belly breath. All right, the next one is the ileocecal valve, is the window between the large and small intestine. We find it by finding the belly button and the ASIS here. Connect these 2 points. It's tender, huh?
A little bit.
Is this tender here?
No. I think so.
Breathing. Good. All right, give me your fingers here. I'm going to check the ilioinguinal ligament. Okay, we're going to start at the ASIS here. Good. Tender at all?
No.
Okay, we're going to trace this to the pubic bone. Is that tender here?
No.
Is it tender on this side here?
No.
Good. Okay, so smile. Okay, unsmile. Okay, we're just going to traction in this direction right there like this. It's going to help loosen all this stuff up over here. Do you get nauseous ever?
From pain.
All right, open. Okay, now relax your jaw.
And my migraines are wild. They're complex migraines, so it's like the first time I got one, I thought I was having a stroke. Like I can't talk, like my speech gets all jarbled, and I can't see anything, and one of my sides goes completely like numb and tingly. But I haven't had one like that in a long time.
That's good.
Yeah.
It's good you take care of yourself.
Trying to.
Is that before or after pregnancy?
Before.
Okay.
I actually got somewhat better after I had the girls.
Yeah, giving birth does amazing things to your body.
Yeah.
It's weird. It's like medicine.
Yeah. It is strange, actually.
That's not.
No.
Why do you think all the things that are normal are strange?
I don't know. Yeah, the Raynaud's went away while I was pregnant, too. I guess because all the extra blood flow, but that was kind of a nice treat.
How often do you experience Raynaud symptoms?
Like anytime it gets dips below 70 degrees.
70. Okay.
Yeah.
All right, smile. Okay, relax your jaw. Relax your face. Okay, say ah. Stick out your tongue. Okay, put it back. Okay, say ah. Okay, I'm going to touch the roof of your mouth, okay? I'm going to move towards the back of the roof of the mouth, okay?
Mm-hmm.
Slowly, gently, across over the maxilla into the palatine bone. Good, you're doing good. Just going to hold right there. All right, let's see. Put your arm up again. All right, make it strong. Don't let me push. Good, just relax. You've never seen this before?
No. I'm nervous.
It's okay to be nervous.
Yeah.
Nervous is just a different form of excitement.
Yeah, that's exactly what I was thinking. What is this? This is so funny to me. Okay. Is it just a form of traction?
Yes.
Okay. Like medieval?
No. All right, so this is a full spine adjustment, okay?
Okay.
Your hips are held in place by the pins. I'm going to use the towel like this. You okay with that?
Yep.
And we're going to go like this. And then as you breathe out, I'm going to follow your breath like this. And then at the end, we pull like that, okay?
Okay.
This is straight up y-axis traction. So, like, there's no scary spinning on this one. Does your neck feel okay when I do that?
Yeah.
Just follow the next breath out.
Oh my gosh. What was that?
Okay, breathe.
Holy smokes. Oh my gosh.
Keep breathing.
Oh my gosh. I almost thought it was going to be like in a spasm for a second. Weird. That was wild.
Hmm.
That legit went the entire way down the back. I did not expect that at all.
Mm. It also cleared out everything else in the neck that we didn't get before.
Yeah. Yeah. I like that one a lot. That was so crazy. I have like the shivers, like, you know when you get cold?
Yeah.
Like sort of like that.
Mm-hmm. Good. You're not cold though, right?
No.
It's 77 degrees in here.
Nope, I'm not cold.
Okay.
No. It's like when you know like when you get like excited, like anticipate something, sometimes you get like, that's how it feels.
Mm.
But I'm not excited. I don't know what's happening. I think whatever you just did is like, I don't know. It's like electricity.
Sweet.
Yeah.
I'm going to do a clavicle maneuver
Okay.
on this guy right
This
here.
would be interesting because I feel like they are the lopsided ones.
Mm-hmm. Yeah, it's the rib torque for sure. All right, so I'm going to take this arm like this. Okay, I'm going to lift this arm up this way.
Okay.
We're just going to gentle lift up the clavicle and towards the ceiling like that. Terrible?
Mm-mm.
That's good.
Now it is.
Mm-hmm. Elbow back against my hand right there. Push, push.
Ooh, that was fun.
Push this side. That's good.
These I sometimes do.
What's sometimes mean?
I hate that one though. It's those little guys that hurt. Why do they hurt so bad?
These?
Yeah.
I don't know. Almost, hold on. White. did that not work? How's that feel up there? That's still tender?
Not nearly what it was.
Nice gentle breathing.